So Lauren, our main exercise for children are the steps exercise, and this involves literally holding of the breath. And I'll go through it. So we'll go through the beginners and then advanced. And we track and we use it as a measurement as well. And the objective is for children to reach about 60 paces or so. Now, it can take a little bit of practice. I know you have a head cold, so your steps are going to be much reduced, but I still want you to show the technique. Is that okay? Excellent. And it will help your head cold as well, because when you do the steps exercise, it opens up your nose like magic, and it also helps to open up the lungs like magic. And that's why we have 20 clinical trials using the Buteyko method for asthma. So we also want to establish, because children with asthma, they don't just have asthma, they often have a stuffy nose, so we want to open up their nose. And of course, if you have a stuffy nose, you mouth breathe, and if you mouth breathe, then our sleep is impacted. So for concentration and all of that good stuff that we spoke about earlier on, nasal breathing is key. So the steps is the main exercise. It's both the main exercise and the measurement of progress. And our steps should be increasing by about 10 extra each week. And we should practice 6 repetitions twice daily. Is that okay? Okay. So now we start. We go do the beginners just to start off. Take a normal breath in through your nose and out through your nose. Pinch your nose and hold and walk about 10 paces. And let go. Excellent. And this is just the easy steps. So you can show the little boys and girls and even teenagers as well. Of course it will help them. We even use this with athletes. So our website for athletes is oxygenadvantage.com, and you will see that we have the Olympic athletes using it, and we have some special weapons and tactics. So these are elite police force using it. So we have the best of the best putting this into practice, and they understand about nose breathing and sports. Okay, and again, normal breath in through the nose and out, pinch nose and hold. 9, 10, and let go. Excellent. So we were just doing a couple of easy ones. It's easy, isn't it? Mm-hmm. So with the kids, when they're starting off, they do a couple of easy ones, and then we do 5 or 6 pretty strong ones, yeah? And we're going to do this with jogging. Okay, so I'm going to mark down then what you got. So we go to our book, which can track your progress, and we literally have our step diary here. So when you do the steps, then we simply mark in what you got. Of course, this is a book about David, who meets Argo the wizard, and Argo teaches David the secret to good breathing for sports. And David wins the race. Okay, so now we're going to go on to the steps, and this time we're going to jog. So whenever you're ready, take a normal breath in through your nose, normal breath out, pinch nose and jog. Good girl. 10. Keep going. 20. Keep going. Excellent. Well done. That was 30. Well done. So even with a cold, okay, there's plenty of room for improvement. We give you a minute's rest, but technique is what I want to show, and you're doing it correctly and perfectly. And of course, you would have more space if you weren't losing as much time on the turn. So I'm going to give you some allowance for that. And this will help open up your nose. It will also help open up your lungs, but it also helps your breathing. So say if we have a little kid who's breathing a little bit too fast, and if they're breathing upper chest, ideally we want them to be breathing nice and slow using their diaphragm, because that's good breathing. And that's why we use the exercises on the couch, the exercises with lateral. Remember, you had your hands on either side of your lower 2 ribs, and now we're also having the steps. So again, normal breath into your nose and out through your nose, pinch your nose, hold and jog. 15. 20, keep going. Excellent. So that was about 26 or so. Well done. And I want you to imagine this diving stick. So the steps exercise is very like swimming, and traditionally doctors used to send kids to swim if they had asthma. And I think it was because the doctor understood that when the child is swimming, the water is pressing against the child, so is restricting their breathing, and also the head is in the water, and of course then that the kids are diving down and coming up, and that's what we're doing here. So we're changing the gases in the blood just a little bit, and we're helping to open up the airways naturally. This is a very natural thing to do. Kids are doing it all the time when you go swimming. And again, take a normal breath in through your nose and out, hold, and off you go. 10. 20. Keep going. Keep going, keep going, keep going, keep pushing. Go, go. Excellent. And this is the challenge. Excellent. And then you calm down your breathing. Great stuff. Is there any difference to your nose at all? Yeah, so it's feeling more freer. Yeah, so basically, you know, all kids can pretty much do this, but if the child is, if they're quite unwell, if they have type 1 diabetes, or, you know, if they have epilepsy, if they have pulmonary hypertension, they should get doctor's approval. But certainly with pulmonary hypertension, don't do the steps exercise. With type 1 diabetes, you have to monitor your blood sugar levels a little bit more, you know, it's because this exercise can lower the blood sugar levels. And with severe asthma, we just go a bit easier. Okay, so I'm pushing you now a little bit because I want you to make more progress. And kids are good with this because they don't have the history that adults had. Yeah? So that's why we want quicker progress. So whenever, take a normal breath in and out, pinch, nose, hold, and jog. 10, 20, 30. Excellent, well done, well done, well done. So you're really doing well. So that's 4 times that we've done it, and we have a minute's rest in between. And we do 6 reps twice a day. And then what we'll do is we'll give kids homework to do, so the kids know exactly what they should do every day. And these videos will be free of charge. So we're making them free to every child who comes across our website. They see the videos. That's pretty cool, isn't it? Yeah. So there's no reason that a child doesn't have access to the videos regardless of where they live. And again, normal breath in through the nose and out, pinch, nose, and hold. 10, 20, 30. Excellent, well done, well done. And 1 minute's rest, and then what we'll do is we'll do the last steps. So it's super. Now with practice, we'd want to be doing at least 6 twice a day, and it will also help your cold. Yeah. So, and you have your mouth closed, wearing the tape every day, and also you wear the tape during sleep, and that helps ensure that your sleep is really good. You know, because I remember as a kid waking up in the morning with a dry mouth, and my concentration was dreadful. Not just in kindergarten, but in high school it got worse, and at university it got worse as well. And I don't want any kid going around with a stuffed nose, and I don't want a child mouth breathing for 20 years because that's what I did. Yeah, we don't want that. So again, take a normal breath into your nose and out, pinch, nose, and hold, and off you go. Good girl. And keep going. And this is going to be a big one. Keep going, keep pushing, keep going, keep pushing. And it's a challenge. Keep going. Excellent. Keep going, keep going. Excellent. Well done. And guess what? I forgot the count, but you did really, really well. And I'd say that was definitely the best one. So I'm giving you 35 paces. So excellent job. We're finished with the exercises. So we did the importance of nasal breathing, why we breathe through the nose, looking intelligent, good for sports, good for dental health, good for concentration on school, etc. And we also showed you an exercise with, if we were stressed, small breath holds, and an exercise to help decongest the nose. And we did functional breathing with lateral expansion and contraction of the ribs using the diaphragm, both lying down but also standing up. And then we brought these exercises into walking, jogging with the mouth closed, and then we did steps. And the main exercises are nose breathing using the tape across the lips for 60 minutes a day would be perfect for at least 2 to 3 months. Nose breathing during sleep, and 6 repetitions of steps twice a day. So you're done. So all of the kids anywhere in the world have access to these free videos. Well done.